Hey everyone, my name is Dr. Jemima Karaoke, and I'm the founder of Wills for Life and Call for Life. And today I just want to take you through anemia in pregnancy. It is one of the commonest issues that we see, especially in pregnancy, and it has adverse effects. For example, if you have anemia, you have chronic fatigue. Beyond that, you have higher predilection to bleeding a lot in pregnancy, especially during delivery, which is one of the biggest issues that we face. And therefore, if we reverse the anemia, we reverse the PPH, and that is a good thing for us. Yeah. So one of the major causes of anemia in pregnancy, actually anemia in pregnancy, sorry I hadn't said, is when your blood level is lower than normal. We base normal as 11. And usually in pregnancy we have something we call dilution, because your body works so hard to provide a lot more for the baby, and therefore it produces more fluid which will be circulated in blood, and therefore it will dilute whatever it is in the blood, which is our hemoglobin. So you'll have what looks like lower red blood cells and lower hemoglobin level, but it's physiological. That is normal. But as the months go on, or as the trimesters go on, then this can actually lower, especially if you had lower stores of iron in your body. And how do you get lower stores of iron in your body? One, if you bleed a lot during your periods. Two, if you have so what are the causes of anemia in pregnancy? The many types of anemia, there is actually two. There is iron deficiency anemia, which is the most common, and then we have folate and vitamin B12 anemia. So folate is very, very key in prevention of neural tube defects, or the spina bifida, or those anomalies we see in babies. The iron deficiency is majorly because of a lot of bleeding. If you bleed a lot because you have heavy menstrual periods, either because of adenomyosis, either because of fibroids, or generally you just have a heavy flow, that would cause anemia, iron deficiency anemia. Lack of proper stores, that means your diet generally is insufficient of iron. There are a lot of fortified foods that nowadays come with iron, folate, and vitamin B12, including the likes of maize flour, the likes of margarine. Usually they do have fortification, but beyond that, how do we know that you have anemia in pregnancy? One, fatigue, excessive fatigue, even beyond the normal scope of pregnancy. Then we have dizziness, lightheadedness, chest pain or shortness of breath, headaches. These are the usual symptoms that when we see, we know, okay, let's test for anemia. I had mentioned that there's a dilutional effect or dilutional anemia. So in pregnancy, it is common for us to check in your first visit to make sure that your stores are not depleted. So what do we do about it now that we found that you have anemia? Lab test, of course, will be done at the facility that you go to, and then once you find your HB is below 11, there is what we call mild, moderate, severe anemia. And based on whichever you have, we may give you supplements, we may give you diet, or just diet only supplements, or now we go into the IV, or sometimes even blood transfusion, and all those are modalities that we use. So for you, the pregnant mom, the concerned dad, what can you do? Diet that is heavy on protein. There is the animal protein, there is liver, which is very good, and understandably so many people may not be able to do that, especially in the first trimester. Oh, I forgot to mention vomiting. If you vomit a lot in the first trimester, it can predispose you to anemia, and we need to correct it in the second trimester. Yeah, so diet that has animal protein, That includes eggs, that includes meat, red meat, that includes liver. If it's vegetables, we're looking at legumes, and we're looking at vegetables in themselves. Skuma wiki or kales is very good for you. Anything that's green leaf, is spinach, is also good for the same. Don't overheat it, you lose the nutrients. Just regular steam and remove, that should be sufficient. There are some fruits known for this. We have beetroot, we have the thorn melon, which is also very good at it, and those are some of the things you can do. Your prenatal vitamins, if you go to a public hospital, they're going to give you IFAS. Every public hospital is going to give you that. It's very good. It has iron and folate. Both are very key for your pregnancy. There's the usual supplements that you can see behind me somewhere, so let me hide. But yes, supplements, the ones that you know that are pregnancy supportive, the pregnant care, the Promember, the Civca, all these things are some of the methods where you can use and get your daily intake of iron. So yeah, I hope this helped someone or the other, and let's prevent anemia in pregnancy. Let's curb it, let's diagnose it, but beyond that, let's treat it so that we make sure you are healthy, especially when we go to deliver and beyond that. Thank you.